Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, I'm going to be discussing the hygienist shortage. And that's a debatable subject. So this is why we're having this video and discussion, because I have seen it mentioned in certain Facebook groups over the course of the past 2 years that there's a hygienist shortage. Now, is there or is there not? That becomes one topic which we're going to be discussing. And then the reasons why. So is there or is there not a hygienist shortage? In my opinion, so this is my opinion, the answer is yes. So why would I say that? Well, the pandemic came about, as we all know, in 2020. And so we had this disease, COVID-19, which basically was a big mystery. Nobody really knew exactly how it would act upon people, affect people, especially long term. The wave that came to the United States February, March in 2020 did quite a lot of damage in terms of that first variant or strain, whatever you want to call it. It caused a lot of people to die in New York City. A lot of people there, and so it had some severe effects upon many people. And so hygienists at that time, who may have been close to the retirement age, decided that it was time to retire a little bit early. Not faulting them. I mean, with no knowledge of what this disease was, how to protect ourselves from it, how contagious it was, which it turns out it was pretty contagious, all that stuff. With all that in mind, people who were close to retirement age, who were hygienists and retired, makes perfect sense. So that's part one. Part two is, you could say, the supply side. We'll get into that in a moment. But, expanding upon part one, other things have happened since then, which have caused this shortage. So one thing that certainly happened is kind of a decline in relation between, dentist or owner, or dentist owner, whatever you want to do it, of a practice, and the hygienist. I saw a lot of posts in different Facebook groups that were exceedingly disrespectful towards hygienists, that were unfair, that were uncalled for, things along those lines. And so with that kind of an attitude towards hygienists got fed up and quit and pursued different careers. Or the ones that were close to retirement, when COVID came around, also may have changed careers. So it was retirements, early retirements, and retirements, coupled with change of careers due to how hygienists were treated, like that legislator, I believe in Illinois, that moron who reportedly, I'm going to say it's likely fact, but reportedly said, "Oh yeah, all they do is scrape teeth." No, that's not true. Hygienists do a whole lot more to take care of our patients, and that was demeaning. So with that kind of an attitude, a lot just said, "Hey, I quit, or I'm changing careers. I want nothing to do with dentistry, or I'm going to go into the sales part of dentistry, or other parts of dentistry, like office management or things like that." So we had a shift of hygienists going to other types of fields or positions within dentistry. So with all of that said, the supply side comes next. And the supply side really either has not changed or has shrunk a little bit. And that's because, because of course of COVID. And so with either the same or fewer hygienists entering the workforce and a larger amount leaving, we ended up with a shortage. Now, the shortage was felt more acutely in some parts of the country than others. Right now, the one I'd like to focus on is the Pacific Northwest, where I do know that there has been rumor, and I'd like somebody from this franchise to respond, if possible, to this video, that corporate entity has stopped hiring hygienists and has a freeze moratorium on it for the next at least year and a half, and will utilize new graduates to do the cleanings, to do the hygiene, and forego hygienists altogether. So, that's something that's come about as a result of the shortage. But what I want to also impress upon the hygienists, and they're folks that I highly respect. I've got great hygienists here. I treat them well because they deserve to be. They do an amazing job, and they deserve whatever instruments they ask for, whatever that they need, to have in their hands to do their job to the best of their abilities, they get. It's without a question. And so, disrespect and demeaning and things like that is not tolerated here. My hygienists are the best that there are, and they are wonderful people, and I want to make sure that they have a great place to work in. That said, hygienists in these areas, in some of these areas where there's a shortage, have taken upon themselves, from what I see on groups, and it's not all of them, it's a number, but it's enough of a number to drive up wages. They've driven up their hourly wage, as it were, to a point where some practices are not hiring hygienists or are relieving hygienists of their duties, and the doctors are doing the hygiene, which not something that I particularly personally like. I mean, I hope that the doctors do a good job, certainly, of course, but I think that it really should be a hygienist thing, because they are, well, it's what they do every day and they do a great job of. So I would much prefer a hygienist do an excellent job, than a doc be kind of thrown into that situation without having done much hygiene and then trying to do their best, because, of course, it's going to take time to get to the level of the hygienist. So that's an important thing. So with hygienists, I hope you're paying attention. If you drive up your hourly wage, or your hourly asking, as it were, your salary requests too high, docs may decide, nope, we don't want you, and we'll phase you out. Again, that seems to be happening in the Pacific Northwest. I'd like confirmation from viewers. But it's happening in pediatric practices. Some, especially around here that I know of, have replaced their hygienists with EFTAs. So yes, expanded function dental assistants can do coronal polishings, and that varies from state to state, what an expanded functions assistant can do. But they are now polishing teeth, which in pediatric practices makes sense. And the doctor can do some scaling, because typically there isn't much to do in almost all cases. Now there are some, but where it's required, but very few. So now hygienists are kind of pricing themselves out of the market. So hygienists, this isn't a slight upon you. This isn't anything negative. This is just what I see occurring, and something to think about, because we value hygienists. I certainly do, but I don't know about other practices. And so, if other mid-level providers pop up, or other states enact legislation where expanded functions assistants can do more, hygienists may kind of be pushed to the side. While I want everybody to work together, I want everybody to be working in harmony, and that relations are harmonious between dentists and hygienists, which I saw, a great deterioration of, and much to my dismay, much to my sadness. I do want to make sure that you realize, especially in the Pacific Northwest, from what I've seen in a number of posts in the past few years, that you be very cautious about asking for way too much, because at that point you may be pushed out the door, and that might cause a surplus of hygienists floating around, and certainly not a very good thing, because while I believe you all should be getting raises and bonuses and benefits as indicated, as it were, everything to be fair and to be right for you, you've got to watch out for being maybe a little bit too eager to get too much. So that's true for everybody, not just hygienists, but this is what I'm seeing. That said, hopefully this has been helpful for everybody. A hygienist shortage, yes, it exists. Hopefully that can be remediated somehow. Maybe new hygiene schools are needed. Maybe hygienists in certain areas of the country will realize that if they ask for too much, it might not be such a good thing, and they need to modify what they ask for. So those are all things to consider. But should hygienists be treated well? Absolutely. Should they be respected? Absolutely. Should they have a place to work where they feel welcome and they feel, able to do what they need to do, and be supported by the dentist owner or whoever is running the office? Most certainly. And hopefully this has been helpful, and wishing you all the best of health.